Hi everybody, it's Dr. Ryan with another video review of one of the Step 1 Free 120 questions. In this video, we'll take a look at Block 2, question number 32. So this question describes a 52-year-old man who has 2 hours of vomiting bright red blood. His pulse is 125, his blood pressure is 90/60. They tell you that he has evidence of jaundice and he has visible blood vessels around the umbilicus. A CT of the abdomen is shown, and what they want to know is to decrease portal venous pressure in this patient, it is most appropriate to place a shunt between the portal vein and which of the following additional vessels. And they give you 5 answer choices, which I'll let you read yourselves. Okay, guys, so this is really a simple question, just disguised by all this unnecessary information. They're just asking you, when patients have portal hypertension and we place a shunt to lower the portal pressure, where does that shunt connect to in terms of venous structures in the body? So before we get into that, let me just quickly review the information in the question because there's a lot of code words here. So first of all, they tell you that this man has 2 hours of vomiting bright red blood and that he's tachycardic and hypotensive. So this man has a very severe upper GI bleed. That's basically what this information right here is telling you. Then they tell you that he has jaundice and visible blood vessels around the umbilicus. So these are signs of end-stage liver disease and cirrhosis and portal hypertension. So this information is just telling you that this man has very severe liver disease and he has portal hypertension. When the pressure in the portal vein gets very high, blood vessels can become dilated around the umbilicus. This is a finding called caput medusa. So basically, they're just telling you this man has liver disease and portal hypertension. They give you a CT scan of the abdomen, but this is irrelevant to answering the question. There's nothing you need to glean from those images in order to get the correct answer. But then, despite all this information, really, they're just asking you a basic first-order question, which is, when you want to lower portus venal pressure in any patient, including this patient, where do you place a shunt to? In other words, what vessels do you connect to the portal system to lower the portal venous pressure? So to understand this, let's imagine that we have the portal vein and the blood pressure is very high in this vessel in patients who have end-stage liver disease and cirrhosis. And that's because the blood can't move through the liver because the liver is cirrhotic. And so when the pressure gets really high right here, the way you lower that pressure is you place a surgical shunt that connects the portal vein to some other venous structure that's beyond the liver. And the structure that this is usually connected to is the inferior vena cava. This is just something you have to know about clinical medicine. We sometimes place surgical shunts in patients with liver disease and portal hypertension where we connect the portal system to the inferior vena cava. This allows blood to bypass the liver and drain out of the portal system, and that lowers the pressure there. So that's the answer to the question, the inferior vena cava. And what's interesting about this question is all the wrong answers are blood vessels that are part of the portal venous system. It wouldn't make any sense to connect one of those vessels to the portal vein because those vessels already have the blood from the portal vein in them. They're part of the portal system. So let's go back to the question. The answer is the inferior vena cava. This is the place where we always connect shunts from the portal system in order to lower pressure in the portal venous system. This is a so-called portal systemic shunt. We're connecting the portal system to the systemic venous system where the pressure is not as high. All of these wrong answers, the inferior mesenteric vein, the left gastric vein, the splenic vein, the superior mesenteric vein, these are all wrong because these vessels all drain into the portal vein. They all have high pressure just like the portal vein does. Surgically connecting a shunt from the portal vein to one of these vessels wouldn't help because those vessels also have high pressure. The point of a portal systemic shunt is to connect the portal system to a lower pressure system like the inferior vena cava so that blood will leave the portal system and the pressure will drop. That's the idea behind these shunts, and it's just sort of something you have to know. I guess you could reason this question out by knowing that the inferior vena cava is the only vessel of the answer choices that's not part of the portal venous system. And that concludes our video review of the Free 120 Block 2 question 32.